Many of us will have heard of Bedlam, or known today as Bethlem Royal Hospital. It was one of the first mental institutions in England, specialising in caring for those deemed mad or lunatic. Bethlem Royal Hospital still stands today as a training psychiatric hospital in London. Its vast and often disturbing history spans centuries. It has been a significant institution in the treatment of mental illness, and its approach has evolved dramatically over time. So let's explore this evolution today. If you enjoy exploring how medicine has evolved over time, please subscribe to my channel, Doctor of the Ages. Bedlam was founded in 1247 by a charitable donation from a wealthy merchant, Simon Fitzmary. Initially, it was known as the Hospital of St. Mary of Bethlehem, and its primary purpose was to house and care for the poor and sick. However, by the 14th century, Bedlam began to specialise in the treatment of mentally ill patients. The name Bedlam became synonymous with madness and chaos. The hospital site in London was known for being overcrowded and for its relatively poor conditions. In the early years, there was little understanding of mental illness, and treatments were often rudimentary and brutal. Patients were often chained or confined to cells in an attempt to restrain them. In some cases, the mentally ill were thought to be possessed by evil spirits, leading to attempts at exorcism. Bloodletting was also used, a common medieval practice where blood was drained from patients to try and balance what they understood as the body's humours. We now know that none of these treatments would have helped the mentally ill. If anything, they would have done more damage than good. In the 18th century, Bedlam became notorious for its treatment of patients. Patients were subjected to inhumane practices, and there was little regard for patient dignity or comfort. Patients were often chained or confined in cells, and there was no real therapeutic care. People would often be kept in these harsh conditions with little or no attempt to address the underlying cause of their mental illness. During this time, Bedlam also became infamous for being a showplace for the public. Visitors could attend and pay to watch patients in their state of mental distress for entertainment purposes. This spectacle reinforced the institution's association with chaos and mental instability, giving rise to the term Bedlam, meaning wild disorder. So-called treatments during this time included restraining patients in chains or locking them up in small damp rooms. They also used physical punishment in the form of whipping and flogging in an attempt to cure patients. Physical punishments were also given for disobedience or patients who were so-called acting out. Public outcry over the treatment of patients led to calls for reform by the early 19th century, and finally, the moral treatment approach to psychiatry began to take hold. Advocates for the mentally ill began to push for more humane and compassionate care. The moral treatment approach focused on providing patients with a more structured and supportive environment. The aim was to offer care in a humane and respectful manner, treating patients with dignity and encouraging social and occupational activities. The construction of larger, more specialised asylums began, but overcrowding and underfunding were still significant issues. Talk therapy was an early form of psychotherapy, and although it wasn't as advanced as modern techniques, it did begin to influence treatment. In 1930, Bedlam moved to a new location in Kent, which is where it is still based today as Bethlem Royal Hospital. The relocation allowed for a more modern and humane approach to treatment, and the name Bethlem was retained as a mark of the hospital's long history. Key developments in the 20th century included the introduction of psychotropic medications like antipsychotics and antidepressants, which help manage the symptoms of various mental illnesses. there were also more structured forms of psychotherapy, such as cognitive behavioural therapy, CBT. Electroconvulsive therapy, ECT, though controversial, was used as a treatment for severe mental illness, particularly when other treatments had failed. Today, Bethlem Royal Hospital uses a wide range of psychiatric treatments based on modern medical knowledge, such as medications like newer generation antipsychotics, antidepressants, and mood stabilizers. Psychotherapy in the form of cognitive behavioural therapy, CBT, dialectical behavioural therapy, DBT, and other evidence-based therapies are offered. There is also a push to integrate patients into community programs to reduce hospitalization rates and promote recovery. Neurosurgery is sometimes used in the form of deep brain stimulation, which involves implanting electrodes into specific regions of the brain that then deliver electrical impulses. This is used to treat conditions like treatment-resistant depression and obsessive-compulsive disorder, or OCD. Personally, I've worked in psychiatric hospitals in the north of England and have seen many patients who were very mentally unstable when they were initially admitted. But actually, after months of hospital care which offered these individuals a safe environment, monitored medications, psychotherapy, and occasionally ECT, the positive outcomes were drastic. It was really satisfying to see these patients go through this journey of recovery. So as we can see, the understanding and care for patients with mental illnesses has evolved exceptionally, and I hope we can appreciate this having explored Bedlam through the ages. I hope you enjoyed this video and found it informative. If you did, please do like, share and subscribe to my channel, Doctor of the Ages.